Hi, so if you're watching this, you are thinking about your teaching learning project. We talked a little bit about this project in orientation, but we also gave you about 1,000 other different points of information. So let's recap what we talked about and maybe go in a little bit more details as to what this project entails. Okay, so let's go over the objectives of this session. We want you to be able to state the purpose of the teaching learning project. We're going to go over what behavioral objectives are and kind of give you some examples of those. We're going to explain the requirements of the project based on the rubric so that you can get as many points as you can. And then at the end, you should be able to implement your own teaching learning project, which is the whole goal of this project. So the purpose of the teaching learning project, of course, number one is because it's an objective of the course. So we've stated that one of the objectives is to incorporate teaching learning principles in providing health education to a selected population. So that's what we're going to do. You're going to choose a population wherever you decide to do this teaching learning project. So you're going to look in your community, you're going to look at your workplace, you're going to look in anywhere else that you're around people and look to see, is there a health education need in this area? So it could be a population of elderly males or elderly females or a group of kindergartners or some registered nurses. So your population could be anything. So when you think about your community and where you want to do your teaching learning project, think about who you're teaching and that overall population, whether or not it's kids, adults, elderly, middle-aged, teens, adolescents. It makes a difference as to who you're teaching. So think about that part of it. Also, health teaching and health promotion is a standard of nursing. This comes from the scope and standards of practice from the American Nurses Association. So this is another reason why this is important in a professional nursing course, because you guys need to be able to know how to put on an education piece for the community, whether it be your workplace or out in your community. You'll see, let me highlight some things here on this. We're not going to read the whole thing, but just to highlight. So our competencies are the first bullet there, provides health education teaching that addresses such topics as healthy lifestyles, risk-reducing behaviors, developmental needs, activities of daily living, preventative care. So that may give you some ideas as to what you might want to teach on. Another thing is what you need to be competent of is uses health promotion and health teaching methods appropriate to the situation in healthcare, consumers, values and beliefs, health practices, and so on and so forth. So this is part of you thinking about your teaching learning projects, who you're teaching, what are the people you're teaching, what are their values and beliefs and health practices? Are they healthy? Are they needing some education so that they can improve their lifestyle? Do they have learning needs? Are they ready to learn? What are their language preferences? So many things that we're going to take into account as we're planning this teaching learning projects. And then seeking opportunities for feedback and evaluation. We're going to also tackle that. So there are, there's a reason why that we're asking you to do this. So remember, this is not a one-on-one patient teaching, okay? You guys do that already all the time, I'm sure, in your various places that you work. We're talking about gathering a group of people, taking in consideration all those things that we just talked about, their values and beliefs and health practices and so on and so forth, and then, providing this health teaching. Teaching in and of itself is a process of imparting or sharing knowledge with one another. And even the National League for Nursing Education in 1918 issued a statement that expressed the need to educate professional nurses to assume teaching responsibilities. So this is something that nurses have been doing and involved with for a century. So this is a a huge part of what we do as nurses. Teaching learning also is considered a public duty of all professions, but nursing especially. We educate the larger public about what we're specifically interested in is quality of life, health. These are things that we want to influence the public in, and our mission as nurses is for society and the public to live healthier lifestyles, and we're going to be those who teach the community how to do that. There are different teaching learning process approaches. The traditional one is what we pretty much have kind of set this project up as following this plan, this approach. There's more information on page 439 and 441, so you can look in your textbook to get a little bit more information. But we basically want you to assess the learning need and then identify, that need. And we want you, again, to identify the population that you're talking about. And then in a little bit later, when we get specifics, you're going to tell me about the learner characteristics of who you're actually teaching from that population. Then you're going to plan your education piece based on who you're going to be teaching. It's going to affect, we talked about this in orientation, if you're teaching kindergartners hand washing versus some registered nurses, the way you approach that, the way you share that information, it's going to look differently. So planning that education piece and then implementing it, so carrying it through, and then evaluation and documentation. So you want to, when you teach something, you want to evaluate to make sure that your learners have learned something. So you'll do that in a way of either maybe a quick quiz and quiz them on some information that you've given, to, some key points that you want them to take away, or they're going to return demonstrate something. If it's a psychomotor skill like hand washing, you want to watch them do it to make sure that they've picked up and learned everything that you have asked them to learn and taught them about. At the same time, we also want your learners to evaluate you as the teacher. We want you to reflect on that teaching learning experience and think about how your learners responded, what went well, what may have if you did this again, what would you have done differently? If you maybe just used a PowerPoint and talked to them, you may think back, I had a hard time keeping their engagement and keeping their attention, so maybe a fun video would have been good to include in that teaching learning project. Maybe that would have helped, and sometimes that does. Or maybe you did the PowerPoint, you did a video presentation, you did some, discussion, or you got the learners involved with the learning and they responded well and everything went well. And if you did it again, you would do it exactly the same way because it went so smooth. Then that's great too. Sometimes it does go exactly the way we envision it. Not always, but sometimes it does. So, so looking back and reflecting, how it went is important as well. Another, just as for the sake of bringing this up, so, not to say that it's not important, this is certainly another way that you can teach is through the holistic approach, and this is found on page 442. This is a more fluid way to impart knowledge on others, and it's basically kind of picking up on those human interactions, the caring, learning how to learn while your learners work toward meeting the intended learning goals. So you're going to learn along with them. You may have to adjust and adapt based on how they're reacting to the information and what you're doing, the teaching strategies. So it's picking up on cues, on maybe even cultural differences, languages, things that you have to take into account as you're teaching. This is done sometimes, but for this particular project, we're going to have you more of a step-by-step approach. Either one is fine and good. Neither one is better than the other, I should say. There are different types of learning. There are, like different educational approaches, but then there's also different types of ways that people learn. And we'll talk about specific ones in just a second. So on page 445, there are 6 types of learning. So item learning, directive learning, rational learning. In your textbooks goes into specifics about these. Also, there are, we talked a little bit in orientation about visual learners or auditory learners or kinesthetic learners. There's different ways, and you may recognize now how you best learn. You may not have a term for it or a name for it, but you may know that you do good when you have videos to watch, or you do great when you're able to take notes, or when you're able to read what someone is talking about. And those are all different ways that you can learn. So certainly think about that when you're planning your education piece, but also think about how other people learn too, because you don't want to zero in on only one learning style. You want to be able to provide ways to meet all different kinds as much as you can that's reasonable. So like we said, having a PowerPoint and discussing, a topic, maybe a handout will help solidify some of the information that you're talking about so that they can have it in front of them, allowing them to take notes. Watching a video can help with those auditory learners and those visual learners too, that they can really see, maybe it's a really good video that really explains and shows the concepts that you're talking about. So, so just think about that when you're planning your education piece as well. These are different principles of learning. So all these things are great to think about, and you can go back and learn more in your textbook. This starts on page 445, and it goes over all of these different types of learning. I will tell you, a few of them. Repetition always helps. Learner control, meaning you kind of engage the learner and let them kind of guide the conversation as long as it stays on task. There will be some times when you have somebody who wants to go off task, and so bringing them back, to the content helps. So active participation, of course, is really good. Organization promotes learning. That's kind of one of my pet peeves, is organization. If I am in a education session and the speaker is not organized, they can't find their notes, they can't get the video to work, now that sometimes is technology, but that's why I always go ahead. I usually at least 30 minutes ahead of time when I'm about to speak, and I check the technology. Sometimes you check the technology and it works, and then when it's time to perform, the technology decides to not work. So that happens occasionally, and so that's understandable. But making sure that you have the video queued up, that you're not having to search for the video, that you've got your notes there, you've got your handouts there. When it's time to maybe assess their learning, you've got the quizzes there, or you've got the return demonstration ready to go. I think you get my picture, that it's best to be very organized and kind of plan and practice before you teach, and that will help, work out some of those kinks as well. It's my pet peeve. I can't stand it when someone is not organized. I get lost very quickly. They kind of lose me, really quickly. These are some other things that you might want to think about. So imitation, motivation is a great one, redundancy, all these things are good to think about. Readiness to learn. I mentioned this just briefly when we talked about the standard of scope. And you guys know when you're teaching one-on-one how important it is to make sure that your client, your patient, is ready to receive the information that you're about to give. So if they just came out of surgery and they are in a lot of pain, right then may not be the best time to be talking about range of motion exercises. Am I right? So if they have been just hit with this huge diagnosis, that day may not be the greatest time to start talking about how to change their lifestyle and all of how it's going to affect their lifestyle. You know, you have to, certainly you have to begin some of those steps, but, you know, assessing when your patient is ready to learn is very important. And I know you guys know that, but I think it's important to also revisit and to remember when we're, you know, rushing into our patient's room to start, you know, throw a bunch of knowledge and information in their face, we need to make sure that they're ready to receive it. So just taking a quick assessment is important when you're teaching. Validating the learning feedback, we've kind of already talked about that it's important to make sure that your learners actually learn what you've taught them, otherwise you know wasted everyone's time. So there's a couple of ways that you can do this. This is not meant to be very difficult. So a 5-question quiz on, you know, the top 5 major concepts that you want them to take away from the teaching and learning projects. Just kind of quiz them. You can do multiple choice, you can do true and false, you can do fill in the blank, whatever you feel like doing and whatever is appropriate according to the content. I will say too that if you're teaching kindergartners who aren't quite ready to read and write, obviously a 5-question written test may not be appropriate for them. So doing a verbal quiz is certainly appropriate. So just tell me about that. Obviously there won't be anything that you'll be turning in to me, but I want to hear you explain why you did that and you know, how you did that and how they responded. It also could be a return demonstration, such as hand washing or any other type of psychomotor skill that you may be teaching, whether it's, you know, maybe finger stick glucose, you know, so on and so forth. And then we also, and I will tell you this, constructive feedback stimulates learners to want to learn more. So if you're doing those psychomotor skills and they're doing that return demonstration, remember to give constructive feedback. So you want to highlight the positive and then, you know, correct what they may need to correct to make sure that they're getting it correct. So when you do that, that motivates them to be more apt to, you know, to want to do better and do it right the next time, and give them a chance to do it right the next time. Strategies for effective teaching and learning, of course, focus on the participants. It's not about you as a teacher, it's about them as the learners, okay? We talked about motivation. We're going to talk a little bit about this, about the environment. Sorry, I'm not the best drawer, especially on computers. So we also want you to do an environmental assessment. So the environment, we want it to be conducive to learning. So if you're teaching some registered nurses at the nurses station, and let's say call lights are going off, the phone is ringing off the hook, the doctors are doing their grand round or doing their rounds, right outside along the side of the nurses station, you have patients coming up to the desk. Is any learning going on at this point? Absolutely not. So that's an extreme case, and I don't anticipate any of you guys using that, you know, type of environment to teach your students. But that's, you know, just kind of give you an idea as to what we want. So we want you to take them maybe in a conference room or a classroom if your facility is set up that way. But I want you to describe, is the lighting good? Is the temperature okay? Are they sitting at a conference table with chairs, or are they sitting more of a classroom setting with tables and chairs that are facing the front? If you're in a kindergarten class, are they sitting on a carpet, sitting around you as you're talking to them, or are they sitting in their desk? You know, what's the noise level? Is there any distraction? So tell me about the environment that you're teaching, because that certainly can affect the learning that goes on. Behavioral objectives. Most people do pretty well on this, but I just wanted to kind of touch on it because sometimes this kind of gets overlooked. So when we look at behavioral objectives, you can just Google Bloom's taxonomy and get several examples of different types of objectives. I brought back the objectives of this session to kind of show the progression of how objectives can be. So behavioral objectives, there's some type of behavior that you want your students to do. So remember, you always start it with, at the end of this session, the learner will be able to, and then you start with number 1. And at this time, with this one, we said state the purpose of the teaching learning project. If you look over here at our triangle, it's down there. And remember, I tried to color coordinate the behaviors of our objectives 1, 3, and 4 to this triangle. So state is down there. Remember, this is the lowest level of thinking that we want our learners to do. So just remember, I want them to recall facts and basic concepts. And you'll see that there's different types of behaviors or words that you can use. So define, duplicate, list. All of those are appropriate. The third one, we said explain the requirements based on the rubric. So this is a little bit higher thinking, where you understand, you're not just remembering a fact, but you're understanding, and you can explain it to someone else. Other words are classify, describe, discuss, identify, recognize. So those are some examples there. The final one is implement a teaching learning project. And so you see that's even higher. So that's in the apply section. So this is where you use information in new situations. So this is when you take the information and you actually apply it to a situation. So execute, implement, solve, demonstrate, operate, schedule. So those are the behaviors that you would use. And you can go all the way up the top, depending on what the teaching learning session is about and what is appropriate. So you'd also have examples in Canvas and in your syllabus of a teaching plan, and this is where you'll state your objectives. This should be the only time that you'll have them lined out. So you'll state the objectives, and these are what you want your learner to do by the end of your learning session. And then there's, how much time you think this will take, how you're going to address this particular objective, and then how you're going to evaluate that particular objective. The plan, the example, obviously you can't use self-breast exams, but it gives you a great example of how to approach that. And if you follow that closely, then you should be good. So here is the teaching learning project grading rubric. It's found in the syllabus and possibly in Canvas. I can't remember now what I've done. So, and then over here in this square are the deliverables. This is what you'll be delivering to me. I am grading them, so let me tell you, it does not, I'm going to be updating the syllabus, but right now you don't have to make sure that this is all in one document. Okay, if you can't get it to all in one document, that's okay. If you have to send me several documents, maybe the PowerPoint and then handout and then your teaching plan, that's perfectly fine. What I will do though, when I give you your feedback, I won't be giving you all that information, or I may not have feedback on every single document, but I'll have it on the main parts of it. So you'll give me the teaching plan, which is that work with the behavioral objectives. Then any handouts that you provide. Now, if you're going to use a booklet, you don't have to worry about sending me the whole entire booklet, but you can maybe make a copy of the front page and the inside cover if it has any copyrighted information in there, so that you can give them credit. You're going to send me the evaluation method for the objectives, and I would like to see those that are complete, that were done by the students. And then the evaluation of the teaching. So we want your learners to evaluate you, and so I want to see their evaluations as well. Now, if you did a verbal or evaluation for, say, kindergartners, again, that's fine. Just let me know that that's what you've done. And then a one-page synopsis covering the information in the rubric. We're going to talk about that in just a second. And then the reference page. So let's go over and look at the rubric. We've already talked about identification of populations. You're going to tell me adults, older adults, adolescents, children, okay? Then you're going to tell me the learner characteristics. It's important to take in consideration the learner characteristics. How much education do they have? How much experience do they have with the particular concept that you're teaching? What are their ages? How many males and how many females? Like I said, education background, experience, all of that information is important for you to take into consideration and when you're teaching, and that I want to know that information as well. We talked about the environmental assessment, and then most important, I also want to know the rationale for the selection of the topic. So I want to know why you chose that topic. Sometimes this part one can be done in one paragraph, sometimes two. It just kind of depends on how much information you're going to give me. So 1 or 2 paragraphs of your one-page synopsis is going to cover part 1. Part 2 of your rubric, the learning objectives, the appropriate time frame, and the evaluation method, that will be part of your teaching plan. So I'll be grading that over there. Back to the one-page synopsis, paragraphs 2, 3, maybe probably just 2, up to 2 paragraphs, 1 or 2 paragraphs, will cover an overall kind of what you did in your teaching learning project. Do not try to teach me what you taught your students, okay? That's not the purpose of it. The purpose is to tell me what you did, that you provided, you know, a lecture with a PowerPoint. I had a 3-minute video, and then we moved over to the sync and did a return demonstration. Of course, I want it to be a narrative, professionally written with grammar taken into consideration, but you know, just real quick, a synopsis of the teaching that you did. The last paragraph should be a self-synopsis, a self-evaluation of the project, reflecting on outcomes of teaching, if learners' response to the class, and if you repeated this session, if there would be anything that you would change. Okay, so that should be the last paragraph, and notice that that is 40% of your grade. So I really want you to spend a lot of time on that last paragraph. It can be 2, the last paragraph. So this one-page synopsis should not be 1 paragraph. It should at least be 3/4 of a page to a whole page. Try not to go more than 1 page. Okay. Try to keep it down to 1 page. If you've gone beyond 1 page, you've gone too much into something. So so cut back, trim back on, and just give me the highlights of that. And then finally, the reference page. Let's talk about that. I doubt there will be anything that you can teach that you have just come up on your own. And so, for instance, if you are teaching on hand washing, then I would expect either the CDC or the World Health Organization to be cited. Okay, they have a lot of good references that you can use and sources that you can use. So they remember we're in an evidence-based practice world, and what we teach is evidence-based. And so whatever you're teaching, there needs to be some evidence, okay? And make sure you have reputable references, okay? So if there's anything that you're teaching new, or anything that you're teaching, make sure that you not only just a policy. If you're teaching a policy update, that's fine, but there's got to be some type of evidence behind that policy. I know at UMC, in our policies, I know at several years ago, I was on the Policy and Procedure Committee, and with every policy we had, just about every policy that was pertinent, especially if it related back to clinical practice, we cited the reference of that clinical practice. And so if there's a change in clinical practice, then there should be a textbook or a journal article or something that supports and gives the reason why we're changing. So just keep that in mind, and also use that reference in your teaching, because that gives you validation and credit when you're teaching whatever you're teaching, that this is science, this is the evidence base, this is why we're changing. And so that's very helpful. I think that should cover everything. So if you have any other questions, feel free to let me know. Good luck on your project, and I can't wait to read them. Thank you.